Hello, my name is Denise Harlow. I'm the CEO of the National Community Action Partnership, and we wanted to talk today about community action as a national network, as a network of 1,000 local organizations that work to fight the causes and conditions of poverty across America. We are pleased to meet with the Kresge Foundation today to talk about the value and impact of this network. And I'm thrilled to say that we're also joined by 3 local organizations, local community action agencies, who will be able to share with you the depths of the work that they're doing, both over the long haul as an organization, but also how they have pivoted in this moment of COVID-19. This is a re-recording of this introductory piece, and Dr. Hatter was great to invite us to speak with the Kresge Foundation team. And I just want to say thank you to her and to the entire team at Kresge for the support they've given to community action. So today we want to talk about a few core components of community action. We want to talk a little bit about, a little bit on the history, not a lot, and also talk a little bit about CSBG. CSBG stands for the Community Services Block Grant. That is what gives the CAP agency in your community its designation as a local community action agency. And we'll talk about how it's oftentimes a small part of a local agency's budget, but it is that designation funding that is federally driven as a block grant to states and then given and granted out to local community action agencies. We're going to talk about how community action agencies have embraced the whole family approach to addressing poverty and how it's rooted really in the history of community action in terms of serving the entire family. Who is coming into the organization. Through no wrong door, we're looking really at what's right for that individual family. And again, we'll talk a little bit about the pivot that agencies are making during COVID. We know now is a unique moment in time. And again, we'll have our 3 agencies talk about their stories, some of the innovations that they've done at the local level, and again, some of the pivoting. And we would welcome your questions and comments. As I mentioned, there are 1,000 local organizations across this country. They all have different names. We're not standardized like United Way or Boys and Girls Clubs. They all have different names. About half of the network, maybe 60%, use community action in their name. Others do not. They'll be called EOC, Economic Opportunity Commissions. They might have names like People Incorporated or Peace Incorporated, but a number of CAPs have community action in their name. And while they might all have different mission statements, more writ large, they do all have a very similar mission. And we're all grounded here in the community action promise. This is something that all of our organizations utilize, and it really grounds us as a network. That community action changes people's lives and embodies the spirit of hope. We see that piece of hope as a critical delineation of what makes community action special. We believe that that hopefulness for families is a critical element in what helps families move along a path toward economic security. That we work to improve communities and make America a better place to live. We talk in community action about serving individual families, but also transforming communities, changing systems through a strong infrastructure of organizations nationwide. We care about the entire community. And at this moment in time, when we look at what's going on in our country and our response to the murders of George Floyd and others in terms of our community's response, community action cares about the entire community. We are grounded in the civil rights movement. That is where our history lies, and our work from the beginning till today is focused on equity, and we include racial equity in the center of all of our work. And we are dedicated to helping people help themselves and each other. We have so many volunteers across this country who volunteer their time in community action. We have board members, and it truly is about that kind of sweat equity concept in community action. We believe in person-centered, but we also believe in the voice of those who are impacted. Our board structure in community action is what we call the tripartite board, whether you're a nonprofit CAP or a public CAP, and I'll talk about that in a moment. We have a board of directors who is 1/3 from the private sector, just like you would have in any other nonprofit. 1/3 are elected officials in local communities, and then 1/3 are democratically selected from the low-income community. We truly believe all parts of the community have a voice in what's right to address the causes and conditions of poverty. And that voice of people with lived experience is not a token voice. It is there on the governing board, the legal body of these organizations, making real decisions. And we have a mantra of maximum feasible participation in community action, and that comes from our grounding in the 60s. From day one, families with lived experience are directing and guiding the work of community action. Just trying to get to the next slide. When we did this live, we did a poll question with your colleagues about some core elements of community action. So I'm just going to walk through some of those questions now. So community action utilizes a lot of different sort of funding streams. We actually leverage about $640 million of CSBG, $740 million of CSBG that come through states and go out to local agencies, and leverage that to bring in $14 billion into this network. That's private dollars, that's local, state, and other federal funding streams. So question number one, we use all federal, state, local. We have private donations, and the volunteer sweat equity, again, is incredible in the network. How many community action agencies are in this country? I've already kind of given away that answer. It's 1,000 plus local agencies. Now, 800 plus of those organizations are 501c3 nonprofit organizations, and they do typically are larger than your typical nonprofit. Typical budget sizes are probably between $5 and $15 million. We have organizations, though, that are as large as $80 million, $120 million, up to $150, $180 million, depending on the year. So it really runs the gamut. But the concept behind that is that our country has an infrastructure of organizations that have the depth and experience and capacity to operate programs that oftentimes don't pay for themselves. Some federal funding programs don't have enough administrative costs. We know oftentimes state dollars work that way, as do sometimes private dollars. So you need to have those organizations with infrastructure. And so that's what our 1,000 agencies do. The other 200 are what we call public caps, and those CSBG dollars come through units of local government. You're going to meet two of those organizations here today, Nashville, Tennessee, and Montgomery County up in Maryland. And side by side with Wayne Metro from the Detroit community is going to show you how public agencies and nonprofit caps impact their local community. How many caps are there in Michigan? There are 28 CAP agencies or community action agencies. I use CAP. I worked for a CAP agency 25 years ago, and that's always been in my mind, CAP. Some people use CAAs, community action agencies. But every state looks different. Some agencies are single county or single city. I think of WestCOP in Westchester County, New York. It serves the entirety of Westchester, but Yonkers has a Yonkers CAP that serves the city of Yonkers. So it really kind of varies across this country about how those organizations have grown over time and the services. There's no one model of a community action agency because local needs, local resources vary. What's going to happen in Topeka is going to be different than what happens in Toledo. And what one of the strengths of community action is that ability to bond within its community. It looks like its community, it's reflective of its community, and it's structuring itself to be successful in their local communities. How many folks are served by community action agencies across this country every year? 15 million people are touched by community action every year. That's a big number when you're looking at a network like ours. And they come from everywhere from prenatal through whether it's early Head Start or our WIC clinics, to senior services and respite facilities and home health care and home delivered meals for seniors. And currently during COVID, we have agencies covering funeral expenses. So it truly is cradle to grave that provide, again, what's right for that family. There's no one model for community action, but 15 million people every year are touched by community action. As I mentioned, we have national presence through the National Community Action Partnership. We're the membership association. We have several other capacity building organizations. CAPLA up in Boston provides legal assistance and advice to community action agencies, and NASCASPA, which works with the state CSBG offices, so we can offer supports because we see our state partners in state government as a critical partner in the fight against poverty. I talked a little bit about the 80% nonprofit, 20% public entities. And while CSBG is our grounding central funding, we know that Head Start, half of our network operates Head Start or early Head Start programs, and about a third of the nation's Head Start kids go through a Community Action Head Start program. Workforce Investment Act, HUD dollars, USDA, all sorts of program dollars flow through Community Action. And again, we take that CSBG and leverage $14 billion coming through this network. And again, we're here to address the unique causes in local communities. We talk place-based all the time. We talk family-centered or person-centered design, right? We can use all those terminologies of art at the moment, but that's what Community Action truly does. We're place-based. Again, what happens in Topeka and the needs in that community and a family needing services is going to be different at any moment in time than even a family in suburban Topeka, right? So you have to really work for the person family center, and it needs to be place-based. We know that's what the research tells us. We are accountable. Our organizations meet organizational standards because of the federal dollars they get. They have audits. They have to follow O1B guidance. There are a lot of hoops that CAP agencies need to navigate, which again gives them that infrastructure nationwide to receive dollars and operate programs and be nimble like this moment in time during COVID. We promote family and individual and community level transformation. We're about systems change as much as we are about family change. Whatever we can do to nuance, to bring people together, to convene, to coordinate, to be that lead agency, to be that hub of a collective impact strategy. Community Action has a unique role to play in that space. And we understand that social and economic mobility is certainly more than money and income. We know it's about hope. We know it's about community connectedness. We know it is about having a voice in your community and some decision making over your own life. We know that savings matters. We take the best research out there and put it into our blender of programs and services to truly help families. And again, you can see here by the graphic, individuals, families, community level transformation, and certainly at the systems level. Now, all of this is grounded certainly in racial equity and equity for families all across America. And we'll talk about more about some of our efforts in that space here in a moment. But we continuously, and in this moment in time, with community action agencies in every corner of America, being able to elevate and talk about race and racial inequity and structural racism, community action has, again, an opportunity to make sure that messages are shared nationwide. Our 2-gen whole family approach to addressing poverty, again, we've used the best research. We've been doing this for years. We know that Head Start was kind of the original 2-gen. It's not the only 2-gen, and it's right now we see it as a kind of a foundation for a high quality 2-gen, high impact 2-gen approach. You can't just work with the kids, right? You got to work with the parents and you got to work with the family. And we say whole family because we know so many grandparents are raising their children. We've been doing this work for a long time. And just in the recent years, in the past 7 years, for instance, we've been working with HHS through the Learning Communities Resource Center, where we've convened communities of practice, learning community groups, everything from service integration, data management systems, to 2-gen in a rural community, to whole family approaches across regions. We've also been invested through states. We have projects and have had in Virginia, Maryland, Tennessee, Minnesota, Maine, and New Hampshire, among others, where the states have invested in the partnership to provide this training and technical assistance infrastructure. And you'll hear later from the agencies, they talk about the value of being part of these communities of practice where they can do peer learning with subject matter experts, convened again by the national partnership, which brings that community action frame to its core. And many of you know that 2-gen approach where, again, child-focused, parent-focused, you're bringing folks together and serving the entire family. Now, data collection systems, all sorts of things come into play, certainly, but that 2-gen framework, as we like to say, whole family, is certainly something that we've been embedding across community action. Now, community action, again, we're grounded in the 60s. We come out of the civil rights movement. Through every decade, community action has focused on equity, and today is no different. The national organization has had a racial equity advisory committee for several years. We are now transforming that to a nationwide equity and economic mobility commission. We have several commissions at the partnership, and so this is going to embed it in perpetuity with membership from across the country with lived experience. Part of the charter of this commission is that individuals with lived experience in poverty must be at the table. We're also, we frame it as baking it into our sauce, equity. All of our programs, all of our services are grounded in this space. We have invested in racial healing with 5 certified racial healing practitioners on staff. We've held racial healing circles at National Community Action Partnership events. We've embedded the Truth, Racial Healing, and Transformation frame in all of our work. And our local agencies right now are speaking truth to power. They're convening conversations on race with staff, with board members, and in their community. They're issuing public statements in communities where these conversations around race have maybe perhaps not historically taken place as deeply as they should have. Community Action has stepped up, and they will continue to step up in that space. Now, during COVID, this certainly has been a trying time for our country. We frame the community action response to COVID in 3 buckets. In the emergency response window, right off the bat, people say, Denise, don't say agencies are reopening because we've been open, we've stayed open. I think about actually, I keep going back to Topeka. The agency there worked with a local credit union and is using a local credit union with drive-through facilities to be able to talk with customers as they drive through, to take applications. Paperwork goes up and over, kind of like when you go through a bank drive-through, right? They are there. They've kept their doors open. They've been creative. They've gone remote. They're working with families. They're doing home-delivered meals. They did drive-through and are still doing drive-through food pantry. Those were the first initial responses. Now here in this next phase, right, this is going to be here for a while. So our agencies, many of them are going back into homes with weatherization services. They are going to have to figure out how to reopen summer classrooms, perhaps for Head Start. They're looking toward the fall in terms of how they're going to navigate families. So their workplaces are ready. There are CARES Act dollars that are going to community action. Now there's $1 billion of CSBG, but there's also HUD money flowing through. We have some agencies, some states where the state housing entity is using community action to take all the rental relief dollars and flowing it through the network because they know that that network has that infrastructure to do it. And resiliency and long term. We don't go anywhere. This country has a national infrastructure to fight poverty. That allows us to be nimble in these moments of emergency. Same thing happened during Hurricane Sandy, Hurricane Katrina, tornadoes in Joplin. We have many stories of community action agencies pivoting, handling the crisis, and being there when some of those first responders need to go to the next emergency. Who's there? Community action. Same thing now. We are resilient. We will be here for the long term. And as we navigate COVID as a country, community action is there for the long haul. And let's move into that local conversation. The national frame is one thing, but what I think is most important is going to be at the local level. Our first speaker here today is Sharon Strauss, known Sharon a number of years. She's over at Montgomery County, Maryland. I'm here in the Virginia area working remotely, so we're relatively close by at the Department of Health and Human Services Community Action Agency. And I always love it when I see a public CAP agency have Community Action Agency in their name, just as I'm thrilled always with a private CAP having that as well. So Sharon, we're going to make sure you're unmuted and have you go right ahead. So Sharon?
Okay, well, thank you, Denise, for setting the stage so well. Montgomery County, Maryland, we are really a stone's throw away from our capital. We are a small agency in terms of people, but we have a big reach. We engage 50 local nonprofits that receive funding from our county to deliver all kinds of emergency support, whether it's food or legal services or social services, engagement, education, literacy, really runs the gamut. We have a Head Start program. We've been the grantee for since its inception with our school system as the delegate. and we serve 648 children. Most of them are 4-year-olds in a county of over 1 million people. We don't have a big reach, and that has to do with some historic changes of suburbanization of poverty. We are the primary VITA provider and have 6 different locations in the county with 2 staff people and hundreds of volunteers. The board is very much involved in hitting those bigger policy issues to try to address funding needs, planning needs, policy issues for low-income people and with low-income people. We're really proud that the leadership of our board has historically included former Head Start parents. One of the leaders of our early childhood work is a former Head Start parent and a family child care provider. We have an advocacy institute that connects local people to help them learn how to become the advocates, and they're serving on all of our county, not all of our, but our county's boards, committees, and commissions. And our direct service site was started in an area of the county that has a lot of challenges. It has historically had a high number of immigrants from places starting from Cuba to Vietnam to Haiti to Central America, now Africa, Ethiopia, and we have had bilingual speakers there and culturally responsive services for many years. We also have an on-site early childhood program that's state supported. And the people who work with us in that office, I will say, are supreme navigators and talented in engaging people in ways that feel safe and trusted. Next. So we are a participant, as was mentioned, with our 2-gen pilot, which received some state money to do transformation of our model. So we've been very much engaged in developing the model that we are looking to connect with different systems of trying to help families more holistically across those systems. So whether the child is in the play group with their parents in our program, or whether they're from Head Start, or if they live in the community, trying to serve those families in a cohort to provide much deeper services than we can typically provide, given the demands for services in the community. And we are part of a countywide effort that's called Neighborhood Opportunity Networks, which takes really the eligibility function, but also the outreach function with our private nonprofit partners at different places in the county. And so that's been something that's been underway since the Great Recession. And our program is, I think, considered one of the best practice models in the county. We are connected also as part of Health and Human Services with Thriving Germantown, and also with the East County Opportunity Zone, the ecosystem project that Kresge supports. Originally, we had services historically at that East County area, and I actually know that area pretty well. We've been connected still through VITA and Head Start, and are working with also our partners in the department to advance service integration. You may know we have a system that took like 90 different data systems and put them together, and that is there's a client platform so that you can help people to get all the services that they need, and you can see what's happening with them in real time. Not all of our systems, though, in community action are hooked up. As I mentioned, we have these different private partners, and they're not a part of that yet. So continuing, next. So looking at COVID in our county, we've had already 664 deaths, almost, 13,819 cases, as well as probable deaths that haven't been attributed. And where they have focused is right where our low-income people live. And so we zeroed in on this data and looked at the population centers, and also noticed the overlap with our Black African American community, just like all over the country. This is a devastating disease that is really a pandemic that is exposing the racial inequality and lack of access that so many people have had. So when our board and our community members looked at this data and also saw that mobility was really impacted too, low-income folks are, as was said before, there's a huge gap between who gets to stay at home and who has to go to work. And that's another reason that people are falling sick and dying. We have the 5th highest level of income inequality in the nation in Montgomery County. So people think of us as having streets paved with gold, and they don't realize that we have many low-income people in really hidden poverty. Next. So for our response, we are looking at the current efforts of the department, because we are the public health agency that has many points of contact for people who are falling ill or being tested from COVID. And one of the things that we have started to connect with is this idea of building the human services needs into that process. So actually one of my team members helped develop the assessment, the quick assessment, to try to connect people to the things they need for social support, food, housing, emergency help. We don't want people, we already know child abuse reports are down, family violence is up. So we can see the writing on the wall and know that we need to connect with people now. This is an important opportunity. Next. Next slide. Thanks. So our plan for using our CARES funding, we are connecting folks through triage and referrals, and we'll be connecting with our partners who are trusted in the community to deliver services with navigators that are funded through CARES, an opportunity coach, and mental health support at our test site, as well as $250,000 proposed for a rental assistance. So that's our model. Thanks.
Great. Thank you so much, Sharon. Appreciate it. Our next speaker, Dr. Cynthia Kroom, the Executive Director of the Metropolitan Action Commission in Nashville, Tennessee. Dr. Kroom runs a great shop, and we look forward to her remarks. Cynthia?
Thank you, and thank you for the opportunity to share with you all today. I didn't provide a whole lot of information or background information about our organization. I will just remind you we are a city-county government entity. We have approximately 400 team members at the Metropolitan Action Commission. We are also a direct service provider. Many of our city-county agencies do a contractual relationships. Metro Action Commission does do direct service completely in terms of our service delivery. I really just wanted to start with talking a little bit about our journey as a community action agency and really getting to a place where we felt like we were helping families out of poverty. And so if you look at the information on the screen, it seems that from 2000 to 2014, we were asleep or we were doing something. It's not clear what was going on. But we were really focused initially on trying to make sure the organization from a regulative perspective was doing what it was supposed to do. In addition to that, unfortunately, our state had limited what we were allowed to do with our community services block grant funding. So you were only allowed to do direct services. So some of the things that we really wanted to accomplish around helping families really move out of poverty, we were limited to some of those activities until fortunately the leadership changed and we were able to really move into how we could see or do things to help families move out of poverty. And so you will note just from the information that I have here, just that we started to really make a progression toward how we could be an agency that was really focused on moving families out of poverty by expanding our focus on looking at data, really looking at pilots that we could do so that we were involved in being able to determine what kind of practice is best that you can be successful with. So we did looked at doing research and other types of projects and evaluation just to determine how do we help parents not just get jobs, because many of our families were employed, but they were clearly underemployed because they qualified for our programs. And you will also note that that journey included in 2019 being selected as a Kresge Next Gen organization. And we attribute part of that to the fact that we were in 2018 a part of the Community Action Community of Practice, where we were able to sort of strengthen our theory of change and really look at how we were demonstrating the work that we do. So you can move to the next slide. I think it's important to know that for us, when you talk about equity and looking at things through an equity lens, because our goal overall was not just that we would help people get jobs, but that we would focus on jobs that were entry level, yes, such as you'll see here with our CDA, but we also wanted to see about assisting our families in getting opportunities in fields that normally they would not go into. And so we looked at the needs assessment for our county and were able to discover that there's a great need for entry-level technology jobs. And so our CompTIA program was started, and that's really the pilot that we did with the goal of helping parents achieve a $19 an hour and above job opportunity. And you will note just from the data that's on the screen, the high participation of females and the high participation of African Americans in our different training initiatives. The CompTIA A+, which is entry-level technology, as I said, had a real focus on 19 and above as the hourly wage. And we'll move on to the next slide just to sort of talk a little bit more about where we were with the wage changes. So our organization did a 3-year pilot, and that pilot focused on looking at could you increase the wages of parents who were going through the Head Start program, whose children were enrolled in the Head Start program, while at the same time improving outcomes for their children. And so what you see in front of you is for the CDA, unfortunately in our community, individuals who receive a CDA tend to be paid a lower wage. In some cases, they're making $9 an hour. But we also knew that we had an ability to employ people very quickly because we have Head Start. And so you will notice that wages for individuals who were originally unemployed went for the CDA from between $11 to $14 an hour. Individuals who work for our organization are paid between $12.50 and $15 an hour, starting off with the CDA. And these are individuals who prior to this were unemployed. Our CompTIA certification, however, when we looked at the study, we did have one individual who went through the program and decided that they were not going to do their work in the CompTIA field, and so they reported their wages at between $7 and $10 an hour. But the rest of the individuals who were in CompTIA reported wages between $19 and $22 an hour. And our CompTIA A+ certified interns, they intern with 5 departments in Metropolitan government. They intern at $20 an hour. If you'll go to the next slide. We also wanted to make sure we were seeing if there was a relationship between certain outcomes between parents and their children. So parents who were involved in our training programs, was there a change in what was happening in terms of their parenting and what's going on with them and their children? The slide in front of you talks about the frequency with which they were having conversations with their children compared to prior to entering the program, whether they kept their children on a routine. Those are some of the things that we looked at in the study and that showed that overall there was improvement in all of these areas. And so there's additional data that also we collect that show happens with the children's outcomes in Head Start when their parents are involved in these various training initiatives. I'm going to move on to the next slide. The next slide really, when COVID-19 happened, we had already had our moment in Nashville. And what you are actually looking at is a picture of the building that's down the street from our main office location. So this is where the office of DHS and DCS, which for us is Human Services and Child Services in Davidson County. This is one of their locations. And then our office is literally 2 blocks from here. And the damage to our office was basically down power lines. So we had already begun our response to our community based on what was happening with the tornado. But our focus immediately became on housing and feeding families. And so you will notice that because there had been damage to so many of the structures in our city, we ended up setting up remote locations throughout our county, becoming a part of a county-wide initiative to make sure that we knew where food locations were. And I want to be clear that we not only fed children as a result of our CACFP type funding, but we also made sure that we used local dollars to feed families, their parents as well. And then because our own team members tended to be exposed to certain things, I also note on the slide that they are paid an actual differential as a part of COVID-19 when they're having to come in close proximity to families. So their pay differential, their hazard pay, is an additional $4 to $7 an hour, and that is also using local funding. Based on my time, Denise, I'm done. I'm up, and so I will stop and move on to you.
Thank you, Cynthia, so much. And I hope folks heard the collection of data and the use of data to understand what happens within a program and to make modifications to a program. I think that's a great example. And to see that, you got folks on the front line from the get-go and that hazard pay piece, I think is a great component. So thank you, Cynthia. Appreciate that. Our final presentation is from Wayne Metro Community Action, excuse me, in Detroit. And we have CAP agencies all over the country. Some are single county, some are multi-county. I have an agency in Texas, have 125,000 square miles they cover with a variety of program dollars that come in. It really varies. And Wayne Metro serves the entirety of Wayne County as well as the city of Detroit. And as someone who grew up in Detroit, it's always great to have Wayne Metro be part of a presentation. So I'm going to turn this over here to Louis Pitzker, the executive director, and Mia Harnos, one of the greats in community action as well, who works very closely with Louis at Wayne Metro. So Louis, excuse me, I'll turn it over to you.
No, that's okay. Thanks, Denise. And thanks, Denise, for having us. And also, I just want to thank the Kresge Foundation, Dr. Hatter, and Joelle. Also, a little bit about Wayne Metro. We have about 517 staff. We service one county, which is Wayne County, and the city of Detroit. We have an annual operating budget of about $45 million. Due to COVID, we're going to end up anywhere this fiscal year, anywhere between $55 and $60 million. So just want to talk to you very briefly at a high level today, just about our transformational work that we are doing at the agency, and also what we've done in terms of our COVID response and the impacts that we are having. So first, from a transformational perspective in terms of the way that Wayne Metro does business, this is a client journey map, and this is Karen's journey. And what Karen was trying to do here on this journey was just receive utility assistance for a back due utility bill. We started doing some client journey mapping to see, how can Wayne Metro be better from a human design and human service perspective. And unfortunately, really embarrassed by this, but I'm full transparency and sharing it with all of you that it took 12 weeks for Karen to be successful in her journey to receive utility assistance. This was like really upsetting to me. It was upsetting to my team. It was upsetting to the whole staff, and we just had to put a stake in the ground and say, how can we do better? And from this point forward, we took the stance of clients first, No offense to any of the funders on the call, but funders last. You know, we're about servicing people, and this just proved that we have to put funders first and have our programmatic structures be human-centered so people can be successful. So next slide, please. So, you know, we thought about, you know, how things are now and it's multiple referrals for services. And we talked about this at Wayne Metro, and we said, you know, how are things ought to be? And we put also a stake in the ground at Wayne Metro regarding, you know what, if somebody comes through Wayne Metro for services, no more internal referrals. Whatever that family needs, they need to get it from the person, that caseworker that they first make contact with. And we need to just break down all of our internal silos at the agency. All of those sticky notes that you see on the slide, even though it might look impressive, that's really a mess. That's Wayne Metro being a regulatory agency. That's Wayne Metro listening and being more worried about funders and monitoring visits than it is about the actual service and wraparounding services and 2-gen services to families to get a better result. And we just really, again, needed to change. And one of the things that we did because of this is we really had to embrace technology in the city of Detroit in order to handle the volumes of a lot of the services and stressors that are happening in the city regarding water. So we really embraced technology in terms of a texting feature, an online application, text reminders, interactive texting with clients to really get our no-show rates down and to get our service and our level of satisfaction up. And so we really put a stake in the ground to be a more integrated, holistic organization and get away from this regulatory space that we were in. Next slide. So from that evolved a theory of change. And our strategic result is about being inclusive and interactive, engaging, and providing holistic wraparound services to people, and doing that in three functional areas or three broad strategies. You know, operational excellence, putting human-centered and putting people first, and also being data-driven. And always doing that through an equity and inclusive lens. So we were able to take our theory of change and being an integrated service, you know, delivery system now at Wayne Metro, and really extrapolate that and put our theory of change to the test as we're facing this COVID crisis in Michigan, and particularly the hardest hit areas, the minority populations that we serve in the city of Detroit. And I'm really proud of the results, and I'm really proud to turn, you know, the presentation over to Mia Harnos. Mia is our Chief Strategy and Innovation Officer and is responsible for a lot of the work and led a lot of the work that she's going to talk about in terms of our COVID response and a lot of the interactions that we're having with staff right now. So I'll turn it over to Mia.
Thanks, Louis. So next slide, please. You know, in the moment of COVID, you know, can't say enough about the opportunities through the Kresge Next Gen cohort. You know, the courage and the strength and the humility that we've had to show in this moment, owning our responsibility, listening, learning, living this mission, y'all put us in a really good place to be able to do that. So I'm going to run through these really, really quickly. You know, Wayne Metro went fully remote starting the second week of March. What we've really worked hard to do is to get everything as simple and easy for our staff and for those who are trying to, you know, access these services. We did develop a universal application. It's taken about 4 to 5 minutes. Next slide, please, for folks to apply. So we broke it out into 6 categories. You know, water probably being the hot button that we all know it is. We've spent a lot of time focused on that, but surprisingly, food and energy utilities has been the highest. So you fill out one application, next slide, you have access to all of these services. That's the front end for clients. On the back end, our staff is able to see exactly how many applications have come in. That 21,000 number has jumped to 34,000. We've got the majority of our staff responding. You can see that Detroit and Highland Park and Hamtramck are the highest rate of applicants. And then down here, what this data is allowing us to do is not only to see how many, it's also allowing us to align that with our funding, make some decisions about moving funding around if we need to. And we also know what our conversion rate is. So really the data is driving every day what we're doing in response to COVID. Next. One of the things I think I'm most proud of is that we are direct service providers, but what we have done is made an investment into our community. We have pumped, of the $11 million of CARES funding we received, we're probably about $2.5 to $3 million in pumping into other organizations, grassroots organizations, re-granting. We just made the decision today to provide $2,500 stipends to 70 community heroes where they can do self-care. So, it's not just helping families, but it really is investing in people and communities. I would say, from a response, what has really kept us close to what is going on is, again, that resident voice. That third part of the tripartite board has actually become our source of strength. And even when it is not comfortable for us, we have actually made it, a priority to lean in, to listen, to not back away, to be highly transparent. And our activists and our protesters and, all of the folks in the community that are leading the charge, the transformation, the change, they are seeing us as very much a part of it. So, we just wanted to let you guys know that community action is, it is a little different than your, typical human service organization or nonprofit. But again, that is where our strengths lie, is in our connections to, the ground. So thank you for that.
Thank you, Mia. Thank you, Louis from Wayne Metro. You saw a lot of data sophistication. You saw person-centered. I saw that journey map in person. It goes on and on and on to get a utility benefit. And they took that information and have pivoted and are using sophisticated systems to make sure the products come best for the family. And listening to the customer voice is something that these 1,000 local agencies do all across the country through board structure, through a mandatory needs assessment that is done by statute every 3 years. Most agencies have their finger on the pulse much more frequently than that, especially now during COVID. They know what their communities need and are finding the dollars. And the partner organizations, you heard that as well. And that's happening in all corners of America. And I hope this gave you a really good flavor of community action. So I'm going to turn this over to Joelle Jude Fontaine from the Foundation, who's going to offer us her remarks and some reflection on today.
Denise, thank you all for your presentations and just sharing your work with us. I think the one thing that I'll say to start off is that you guys are so appropriately named, right? So as I was listening to all of the presentations, the fact that you guys have action in your name is so appropriate, because I think that that is exactly what you have done historically and certainly what you have done in this moment. I don't know if all of you realized, but when Cynthia was talking and she showed us the picture of one of their partner offices, that was because on the heels of COVID, Nashville was also dealing with a tornado that had just hit. And so I think that this notion that the community action agencies just like jump in, they don't miss a beat. I think the other things that I really want to highlight, for me, what stood out is, like, I was listening to all of you, and I think that it's made clear to me, and I hope to everyone else on the call, why it is that the Human Services team has partnered with you all. So I think, first of all, I'd say that the reason I'm providing reflections is because we've partnered with all of these organizations, and as Wayne Metro and Metro Action have indicated, they've been a part of the national and the city-based Next Gen, and then the Montgomery County CAP. They are a partner with Montgomery County Human Services that has been supported by us both through our ecosystems and our health and human service integration work. So I'm hoping some of what you have heard in terms of why we've partnered with these organizations is just that they are, dogmatic around person-centered approach to the work, but also person-centered systems change. Also the fact that they've got to focus on social and economic mobility. I'm sorry, guys, my computer has a mind of its own. It keeps jumping out. A focus on social and economic mobility, as well as racial equity, 2Gen, and even, how they have applied the human service value curve, in terms of, they've talked a lot about some of the pressures of having to address the things at the regulatory stage, but yet they all aspire and are working towards that generative stage. And so I hope that in this presentation that you all have seen all of that. They are incredible partners doing amazing work on the ground. We are just completely honored to be partnering with them in this work. And I don't want to say too much more because I want to open it up for discussion and questions.
Great. Thank you so much, Joelle, and we appreciate the great work that you do hand in hand with the agencies, and just thank you for that. The lines are open. You can either put questions into the chat window. We would love to hear your questions live and be able to dialogue either about a national issue or any of the local agencies. Who would like to start? You can unmute yourself in this setting. I believe we're in meetings, so you're able to or do they need to be unmuted, Zandy? I'm not sure.
So we're in an event. Not sure folks are actually going to be able to unmute.
My apologies. Okay. Then they would probably need to be into the chat window. If folks want to put in questions, we're happy to read them back out loud and answer them. In the meantime, I might ask, I'll circle back to Cynthia. Anything that you'd want to add hearing some of your partner presentations that you think would particularly resonate with some of the comments of Joelle that we just heard?
Well, I think when Joelle was talking, I thought about probably not going to answer your question, Denise, so let me apologize, but I thought about just how losing that building literally 2 blocks away and our own building being down, that there were literally wires across the street, but our customers were still looking for us. And so we ended up taking one of the diners that we own and parking in our parking lot and having other people there who serve the community with Wi-Fi on those vehicles so that we could make sure that if by chance somebody came to our location, that there would still be people present to at least help them or make sure they knew what they needed to do. The other thing that I think is important to note is that we were housed with a number of our partners at various locations throughout the community because people even in the midst of something as difficult as what they were dealing with, they still looked for us at our buildings, even though we physically couldn't go inside of our building. So I think that may not answer your question, but that's certainly what I was thinking about when Joelle was talking, just that our customers are used to being able to locate us. And they don't always want to talk to us by phone. They want to see our faces. They need to know that somebody's there and that those folks that they're used to being able to turn to are still able to respond to whatever their concern is.
Well, and for local agencies to be that resilient in the midst of that crisis so you could be present for the families that you serve, just in a new, maybe even physical location or in a new way, is so critically important. And we've seen agencies, whether it's tornadoes in Joplin, whether it's Hurricane Sandy in New York City and New Jersey, whether it's hurricanes on East Coast, West Coast, seeing community action agencies pivot in times of crisis and keep the doors open to be a resource for families is wonderful to see. I see a question that's come in. Mia's data about triage and support during COVID was incredible. How might this quick adaptation apply long term? How does it impact the practices of partners locally?
So the great news is that all the work that we have done has with the application, with all of the reporting, with all the documentation that is necessary, we have done that all in a Google environment. We actually managed to break Google. I didn't know that was possible, but just due to the volumes and all of the cells and all of that. So we have a Gen 1 application that went through the end of last Friday, and then we started a Gen 2 application. We have actually been invited by the brilliant people at the Community Action Partnership to be a part of a small group that is working to bring what we have done to the broader network. And that is, low cost, simplifying everything. What community action isn't, I would say, and we say this with love and, all respect, we are not technically inclined. That is not why we come to the work. So we really need to find solutions that accomplish the goal, but that are easy and simple. And so we are committed. Nadeem, Siddiqui, he's our data strategy director, and he is highly engaged with both the state of Michigan and now with the CAP partnership. And so we will be bringing all of this, the power of what we've been able to do in Detroit and Wayne County to the entire network. We're very proud of that.
And we're thrilled to be able to have you bring that to the rest of the network and the partnership with the state. I hope that folks heard that as well. We did a presentation with Wayne Metro and the state of Michigan and talked about how the state of Michigan was using what they've learned and gathered from Wayne Metro as a CAP agency to determine how other data could be displayed, how dashboards could be better utilized, how to take these Google documents and create other systems. And seeing the state and the local agencies work hand in hand and take that knowledge to help other organizations will pay dividends way into the future. And the question is, how does this impact the practices of partners locally? I think so much is going to be happening and already has happened, but if you look 6 months down the road, this learning is going to impact human services provision over the long haul, both from a technical perspective and a programmatic perspective.
And Denise, I want to add to that. I mean, I think that Maya probably understates their level of expertise, because I think that, when I did the site visit almost 2 years ago, I mean, they were definitely already thinking about how to facilitate the navigation for their clients and participants. And so certainly we're thinking about what are some of the online platforms and web-based platforms that could be used to facilitate in-person meetings. So I certainly think that they were way ahead in their thinking. And Louis, I'll say to you that actually, so that when you had indicated to me that you guys had made the intentional decision to put funders last, that was actually a selling point, right? Because I think that in this work, it is important that we're always clear about who we're here to serve. And certainly appreciated you guys doing that work internally and kind of recognizing that you needed to shift your systems and your approach towards people and being people-centered.
Well, thanks. I appreciate that. I think just as service providers, again, with all love and respect to everybody, I think community action, I think we do a great job serving people. But I also think that when you can get beat down by the monitoring visits and by the comments and the pressures from the board to have perfect visits and no findings, that you sort of unintentionally shift to maybe programming around rules and regulations and not people. And we fell into that trap. And once it smacked us in the face, we needed to stand up, recognize it, admit it, and make a statement that we weren't going to do that anymore. And I think it's really changed us in terms of making just that stand, and everything around client-centered perspectives has really changed us and allowed us to like really leap forward. So thank you for that comment. I appreciate it.
Yeah. And I also say, Denise, like I think that, so I've had the amazing professional development opportunity to be a part of the Michigan Commission on Community Action and Economic Opportunity, and just kind of seeing this trend, within the state and nationally, right? Because we actually have two community action agencies as a part of the National Next Gen cohort. And so really seeing how, even though, community actions came out of this notion of partnering with community and being engaged and in partnership with community, that has evolved over time, and you're continuing to perfect it. And I just really appreciate how just nationally you guys continue to evolve in this work.
Well, we appreciate that, Joelle, and to have investments that can help within states, because we know state policy has such an impact on how local agencies need to perform. So when we're able to work with the state of Virginia, they're actually taking TANF dollars and investing them in community action to do a 2-gen cohort. We've been brought to Minnesota for all-day convenings with the state of Minnesota, along with other nonprofit human service providers, to talk about that frame. And so taking an infrastructure expertise piece and being able to take that around the country and partner with state governments and local entities, we have found to be an effective approach. And I think there's so much more to do in that space and learn in that space.
Right.
Sharon, I don't see any other questions yet in the chat window. We have a few more minutes. Sharon, in Montgomery County, you talked about certainly having to partner with other external organizations alongside your local governmental unit. You want to talk a little bit more about how that works from your perspective, and any other feedback you'd like to give what you've heard so far here today?
So first of all, I want to just take my hat off to Kresge for its work in our county, because one of the things that's been happening in the last 6 months with the it's almost like the merging, I'll say, of the whole family work that has been happening in community action with the department's efforts at systems integration, which is really aligned with our equity initiative and the place-based work that's happening both in East County and Germantown. So, and this recognition, when I looked at that journey mapping about how we have to change our service delivery so that we are not making we spend so much energy, and actually we spend a lot of money helping people figure out how to get from here to there, and what we need to do is not make it their job. But I would say with the partnerships, there's two really exciting efforts in Montgomery County. One has to do with the Food Council, which then changed into, with this COVID emergency, a Food Security Task Force, where there's just been this tremendous use of data at looking at where poverty is, where food providers were, where transportation barriers were, where underserved folks were not getting their needs met, either because they're young children and there's barriers there, seniors, people who have different food needs. And so now that the needs for food have been magnified in ways that we've never even imagined, and the response has been really, how do we coordinate that and make it so that we can work quickly, and then people taking pieces of that from our community action family, whether it is helping with the language access or the communications plan or the operational needs for our providers who are funded by county contracts but need adjustments in order to be responsive. So that's one effort. And then the early the early childhood education initiative, which is a multi-year strategy of trying to think about the needs of our children and not have it be so categorical where, Head Start, everybody go over here, and for child care subsidies that are funded by the county here and for the state there. And how can we just make that, again, very, very seamless and easy for parents, but also how are we going to meet the needs of providers who have totally lost their stream of revenue during this emergency, and how are we going to be responsive to them, and knowing that many of our providers are also our low-income community members. So those are big challenges, but we don't have any other choice. We're not going to have the kind of money that we have this year, I don't think, coming forward from the federal emergency funding from the CARES Act. So I think our need to try to learn from everybody here, and with the guidance of both our national, local community action partners and Kresge, our philanthropic investors and thought leaders. I mean, we just have to find better ways of serving people.
Yeah. And I'll add to Sharon. So I think that, thank you for the compliment, but I think that for us, it's the opportunity is for us, in that we've identified a locality where there are just so many things in play, and it's just working well. I think that the way in which we entered into Montgomery was certainly with the Office of Health and Human Service, but what was unique about that endeavor was the way in which, while the office was kind of leading the ecosystem's work, I think that seeing how closely connected and the relationship between the community partners, and kind of CAP being one of those, and how you're really trying to figure it out. I think that through the Health and Human Service integration work, really trying to figure out, okay, how can we ensure that we're all getting access to the appropriate data? The agency recognizing that the local partners are some of the highly trusted partners for their participants. And so how do you capitalize on that? So I think it's because of the work that you guys are doing there that we are there, and certainly not because of Kresge. We invested the dollars there, but because of what you guys are doing. So
Great. Thank you, Joelle. Raquel, we'll turn the ball back over to you to wrap us up here this afternoon. I think we've almost stayed on time.
Wow, and thank you. I thought I was done. But since you guys did such a great thing, and we really appreciate everybody being on the call today and your contributions, and in the effort to give people back a minute, I'm going to close it out and do a shout out to community action agencies in action. Thanks so much for all you guys do. We are better for it. Thank you so much.
Thank you, everybody.
Thank you,
everyone. Thank
Have
you.
a good evening.
Stay safe.
Have a good evening.